The related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Healthier Life, proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Happy Thursday, everyone. Welcome to You and Your Doctor, sponsored by All County Healthcare. I am your host, Dawn Graubert. All County Healthcare is a Medicare certified home health agency working in Dade, Broward, and Palm Beach counties. You can give them a call at 954-717-7027 or info@allcountyhealthcare.com. All County will serve everything that you need, from home service aids, laundry, driving, even nursing care. So anything that you need, just contact All County Healthcare. It's 954-717-7027. Tonight we are working on getting Dr. Alex Malfatti joining us. We're having a little bit of technical problems with firewalls, but we're working on getting him on the phone line. While we're working on that, let me give you some background on Dr. Malfatti. Dr. Alex Malfatti is a board-certified family medicine physician specializing in primary care sports medicine with Baptist Health South Florida. He focuses on the non-surgical treatment of acute and chronic orthopedic conditions, helping patients safely return to the activities that they love. Dr. Malfatti earned his medical degree from Ross University School of Medicine and completed his family medicine residency at the University of Connecticut School of Medicine. During his fellowship, Dr. Malfatti trained in the non-surgical management of acute and chronic orthopedic conditions and gained expertise in ultrasound diagnostics and procedures. He has extensive experience providing sideline medical care for professionals, collegiate, and high school athletes, and continues to serve sports teams throughout South Florida. Known for his compassionate, collaborative approach, Dr. Malfatti empowers patients to actively participate in their own care. Whether they're recovering from injury or optimizing performance, Dr. Malfatti believes in a compassionate, collaborative approach to care. More information, you can find him at 561-955-6784. He's located at 745 Meadows Road, Suite 100 in Boca Raton. Again, that number is 561-955-6784. Okay, I believe we have Dr. Malfatti on the line with us.
Hi, Dawn. Yeah, I'm here. Thanks for having me tonight.
Good evening. Thank you so much for joining us. So sorry for the technical difficulties, but I'm glad we have you on the phone line.
Yeah, no, I apologize. I was trying to work through the firewall, even through my phone and computer, but we'll make do. Here we are.
No, no worries. We got you. I want to ask you, though, primary care sports medicine. It's about helping people move better, feel better, and stay active. But how is primary care sports medicine different from orthopedics or primary care itself?
Well, they are inherently different. One, a primary care sports medicine physician is not an orthopedic surgeon, so there's no surgeries being done. A lot of these are minimally invasive procedures, usually injections. The difference, I'd say, is the primary care sports medicine doctor really takes the time to listen to the patients, do a full comprehensive exam, order whatever diagnostic imaging, and kind of help get the ball rolling in whatever ailment is bothering you. Whether it be starting with physical therapy, whether it be home exercises, some oral anti-inflammatories, they're able to help assess what you're doing, whether it's working, not working, and get you in the right direction to get the care that you need, whether it be surgically or non-surgical.
But for surgical, then you would refer it to an orthopedist or a general surgeon.
Exactly. So I'm in a group. I work for Baptist Health Orthopedics. We have a lot of different specialties within orthopedics: upper extremity hand, and knee replacements, there's sports surgeons. There's little different niches within the orthopedist, and the primary care sports medicine physician is able to help quarterback what type of care you need, and is this something that you can try something conservatively, trying therapy, trying activity modification, or is this something that needs surgery, else there's going to be complications down the road.
And tonight we want to talk about exercising safely for all age groups. Now, for someone who hasn't exercised
starts with that.
in a while, someone who they're just saying, you know what, it's my New Year's resolution, let me get back into the gym. What are the first steps that you would take?
I think it's pretty important to understand you're not your younger self. I think it's important if you've had a break since your prior activity to start slow and really start with low impact activities, and then build your way progressively to seeing what you can withstand. Ideally, like really listening to your body, trying to not focus on too much strength and focusing on proper form, making sure that you got all the basics right and that you're not overdoing it, and then slowly build up onto what you can withstand.
Are there certain exercises that you would recommend starting with?
Yeah, I think it's helpful, to start with your own body as your weight, biometrics. I think basic exercises like push-ups, squats, planks, all these things that you don't necessarily need gyms for are reasonable things to try, starting on a treadmill, walking, cycling. All these things are helpful to assess. And if you have difficulty with those are more reasons to be like, all right, maybe I should get things checked out because I can't do the basic things.
It's funny, I've exercised for many years, but as I've gotten older, I forget that I'm older, and I try to do the things that I used to do, and I still do them, but then I'll wake up and I would run and my knee's a little bit tweaked, my lower back, maybe my Pilates bar, I had too much weight on it, things like that. So it can be for anyone that's even exercised, that you have to really listen to your body.
For sure.
And what are some signs that people should look at before they call you?
Yeah, I think if you're trying to do something and it's continually bothering you, and limiting the things that you enjoy, those are good times to pop in and be like, hey, I'm trying to maintain this activity, but I'm having difficulty X, Y, and Z exercise. Is there something structurally wrong? Is there something that is just an overuse? Or is there something that you've just been always taught wrong in not the proper form that's just getting worse?
And if someone comes into you for something and it's not a proper form, is that something that you might refer them to physical therapy for, or would you refer them out for one-on-one training at a gym? How would that work?
Yeah, I typically refer a lot of patients to physical therapy, and I try to equate it to me hiring a personal trainer for you to show you how to do the right exercises, provide other modalities like icing, heat, stim, dry needling, and that gets covered by insurance, and I call that a physical therapist. And they really work hand in hand together with the patients, and they provide the feedback to the doctor to assess whether the patients are progressing in the right direction. And it's someone that you have a more frequent touch point with. You see the therapist a lot more often than you see the physician. So if they're improving, they're going to be able to get that feedback, knowing that if they're struggling and they're not able to progress in the typical manner, then the therapist is going to put the pause and be like, hey, this is not going the way we think. Maybe we should touch base with your doctor to making sure that everything's in the right setting before we continue to proceed.
And if someone's having pain and they're going to call Baptist Orthopedic Group, how would they get to you versus an orthopedist? What would be the segue when they call?
I think, so I'm an entryway. I have an open available schedule that I take walk-ins, but I also don't have long wait lists. Some people specifically are trying to see a particular surgeon and sometimes end up seeing me prior to that so I can do a workup and provide whatever needed to the surgeon in a timely manner. Or essentially anything that walks in the door, I'm at least happy to see, assess, and put them in the right direction. Some things do get better with conservative therapy. Some things fail conservative therapy and just necessitate that further intervention could be needed.
And how important is strength strength training, whether it be for beginners or even someone going through menopause. They talk about weight-bearing exercise for osteoporosis.
Mm-hmm. I think it's paramount. I think it is something that we continuously lose as we age. So if we tackle that on the front end and try to start strength training earlier on, I think it builds us more mass to lose down the road. Typically, strength training is 2 to 3 times a week of strength training, in addition to like the general recommendation is 150 minutes a week of moderate intensity activity combined with 2 days or 3 days a week of strength training.
So activity being walking, elliptical, right? We don't want to talk about running
walking,
for just beginners.
Elliptical. Right, but some people are able to withstand some running in low intensity and low mileage. I think if you were a runner and you had no problems, then instead of running however tens of miles you were running before, start low, start less, and make sure that you're able to withstand a mile, 2 miles, and then go forward from there.
And what do you think about running versus walking? I've seen different studies that are now saying that walking will give you as many benefits cardiovascular-wise and heart-wise as running versus walking.
I think it's really about what can get your heart rate going for the cardiovascular fitness-wise. Walking is definitely more controlled and more predictable. Running is more high impact. It's over time can be destructive to the cartilage. Now, both of them are weight-bearing activities, but if someone who has arthritis may not be able to continue running, and they may focus to faster walking, or they may try running, but the running causes increase in swelling and causes them to then have to take down days. And I want to also encourage, don't forget rest days. It's not, you don't have to be working out every day, all day. There are certain times that your body needs some break in between to allow that recovery, that rebuilding of the muscles.
Great point. All right, so 2 to 3 days of weight-bearing exercises, 150 minutes a week of moving, cardiovascular, walking, steps, whatever that looks like. How many rest days a week?
Or 75 minutes of high intensity activity, right? This is what CDC AMA recommend. They recommend either 150 minutes of moderate or 75 of high intensity exercises, which are more taxing.
All right, so rest days, 2 days a week, 3 days a week.
Listen
to your body.
I'd say if you're exercising, if you're doing, let's say, 50-minute sessions 3 times a week of cardio, right? And then you're doing 2 days a week of strength training, that gives you 2 days throughout the week to give your body a rest intermittently.
It's about a well-balanced, well-oiled machine. All right, Dr. Malfatti, we're going to take a quick commercial break. When we come back, we've got more questions. You can reach Dr. Malfatti at 561-955-6784, located right at 745 Meadows Road. More to come on the other side of You and Your Doctor, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency working in Dade, Broward, and Palm Beach County. Give them a call, 954-717-7027 or info@allcountyhealthcare.com. Tonight, I'm excited that we're talking to Dr. Alex Malfatti. We have him on the phone line. Dr. Malfatti is with the Baptist Health South System, with the orthopedic group of Baptist Health. And I want to bring Dr. Malfatti back on the phone line because I find your training so fascinating. I want to get back into really that you do non-surgical management of acute and chronic orthopedic, as well as ultrasound diagnostics and primary care. So tell me about your interest. How did you end up in this field?
Well, I think it starts with me being an athlete in high school. I was a competitive tennis player and always had a niche for sports. As I knew I wanted to be a doctor from an early age, and I was always figuring out what way to connect doing what I love with the mind, what stimulates my mind. Initially, I really thought I wanted to do orthopedic surgery. I thought, it was really innovative, but then I felt like I'd be worrying a little too much about every incision that I'd be doing, every little bone cut. I wanted to make sure it was perfect. And I thought once I got into the OR, it really wasn't my vibe. So then I took a step back and I thought, what are other ways that I can help this type of patient population? The typical route is, one option is doing a family medicine residency, which is a primary care residency, learning everything about diabetes, hypertension, weight loss, cholesterol, anything you can think of as a primary care physician. But that avenue allows you to then go to further training in a fellowship where you learn how to incorporate what you learn as a family physician and then add that into the orthopedic world. When it deals with the primary care, the other thing it adds is that I'm a primary care doctor for athletes. So I'm the team physician for FAU. I see all their athletes, some of them for their orthopedic complaints, but also for their primary complaints, their medical family complaints, upper respiratory infections, GI illnesses, whatever it could be. I'm their concierge physician. They call me with whatever they want, and I help facilitate getting whatever they need done.
That's incredible. And you see the differences from your FAU students, right? These are student athletes, to your practice at Baptist Health, where you might have someone who comes in with diabetes, heart disease, they want to exercise, the do's and the don'ts, right? You can manage everything that they need cardiovascular wise, managing sugar levels, and then you work with the exercise from that point. Yeah,
but you also got to make sure that they're fit to play, and making sure that they're okay to, do their physical, to making sure that there's no underlying problem in certain screens that we look for to avoid potential catastrophes.
For the students.
Yes, for the students. I'm not a primary care doctor now currently for the community, but the information that I have as a primary care doctor and the training that I have as a sports medicine doctor is what puts me in the position to be able to be a non-operative orthopedist.
And the ultrasound diagnostics, how is that helping you diagnose different injuries?
Yeah, when people come in and describe to me that they twisted their knee or that they had a certain shoulder problem that they feel, in real time, I have an ultrasound in my office that I'm able to use and dynamically manipulate the patient's extremities to assess if there's any injuries to either the tendons, the ligaments, the soft tissues, and then make a prompt diagnosis. And also the ultrasound is used to guide the interventions. For example, people that get knee injections, one option is putting the needle in the front of the knee going into the joint. But But another way to do it is from the side, on the outside, where you can see the needle entering to the pocket, and it's under guidance to confirm that the injectate is going into the place that it needs to go.
Which means you can do a lot right there on your first visit instead of having to go out for an x-ray for all patients and then an MRI and then wait for the results, come back and see you.
Correct. That can give me an idea, but still typically x-rays are ordered. Ultrasounds are done in the office, but sometimes to confirm a diagnosis, we do order MRIs that do have some turnaround time that got to get read by the radiologist and can kind of confirm what you're viewing on an ultrasound.
And you have a multi-specialty group right within the Baptist health system, so you can get all of your information within the same EMRs if somebody goes out and when they're seeing someone else within your practice.
Correct. And then there's swift referrals. If someone thought that they needed surgery, they chose against surgery but wanted another type of intervention, then that patient is going to get referred to me within the next couple of days from that surgeon, providing the intervention requested.
So it provides great quality of care, great follow-up continuity, and everything is right there, better for patients all the way around.
Yeah, we also do orthobiologics. So I get a lot of questions about platelet-rich plasma. Those are adjunctive therapies that can help promote an inflammatory response to hopefully heal a little bit better.
And what are some of the other biologics?
There's also another term is called bone marrow aspirate concentration. So a PRP injection is blood that is taken from your arm and put in a centrifuge and harvest the platelets and then reintroduce those platelets into the area of concern. Similarly, in a bone marrow aspirate, it'd be coming from your hip bone that you would take the bone marrow from that, then put it in a centrifuge and then inject that derivative into the same area.
There's so many options now for patients, so it really returns them to work and functional lifestyle, which is incredible. Not everyone has to have surgery or major procedure, that you can get them back to the lifestyle that they want to have. Did I lose Dr. Amalfi?
I think we cut out.
Oh, you're there. Okay.
Yeah, I'm here. I hear you. A little bit. Yeah.
We're just talking about the availability of really not as many procedures having to be done.
Well, the goal is to do the procedure that's needed and not have to go procedure, then unfortunately still have pain and go through something else. So you want to prioritize what you think is going to do the most good without having to incur another type of surgery. With chronic conditions like arthritis, for example, yeah, you may end up with an injection at some point, but this is something that's chronic, waxing and waning. One injection is not curative. It just helps pain and inflammation and able to tolerate what you would demand. So it's really individualized. You got to take an individualized process, see what that patient wants, what their expectations is. They may be a surgical candidate, but they may have a problem that needs surgery, but may not be able to withstand undergoing under anesthesia. So then you need to figure out other ways to decrease their pain, even though surgery ultimately is what's going to fix them.
And sometimes it's not returning back to athletics. Maybe it's returning back to sitting on the floor and playing with your grandchildren, or just being able to pick them up and enjoy spending family time. Not everything is always cut and dry, right? It's functional lifestyle.
No. Case in point, I see that every day.
All right. What is the best way for people to reach out to you?
Best way to reach out is to either give our office a call at, I wish I knew our number, but either that or finding us online and scheduling an appointment online straight through the Baptist website, or yeah, I think those are the easiest ways to
All right,
get
the
there,
phone number
knowing
I
that
have
there's availability.
is 561-955-6784. And before we wrap up, one fun fact about you.
One fun fact. I enjoy playing padel.
What is that?
Padel is it's not pickleball and it's not tennis. It is how do I equate it? Maybe a mix of squash and racquetball.
Oh, wow.
It's a racket sport played in a glass cage that is a little more intense than pickleball, but a little less than singles tennis.
Oh, my gosh. An athlete through and through.
Yeah, yes, and you may be seeing these popping up into the West Palm area for sure.
Amazing. Dr. Malfatti, thank you so much for joining us tonight on All County You and Your Doctor. Such a pleasure. I hope to meet you in person one day soon.
Thank you for having me.
Thank you for joining us on You and Your Doctor, sponsored by All County Healthcare. Again, to reach out to Dr. Malfatti, you can reach him in his practice at 561-955-6784, located at 745 Meadows Road in Boca. And to All County Healthcare, you can find them at 954-717-7027, info at allcountyhealthcare.com for all of your Medicare surgical certified home health agency needs. Until next week, we'll see you then. Have a great night and a great week, everyone.